Mitchell reporting to you live from the Digital Health Summit studio at CES 2016. I'm here with my friend Dr. James Mault from Qualcomm Life, and he is the VP and Chief Medical Officer, so welcome to the show. Thanks for coming.
Thanks, Laura. It's a pleasure.
So tell me a little bit more about what Qualcomm Life is doing. I mean, we all know what Qualcomm is, but tell us about Qualcomm Life. What exactly is that?
Well, for a few people who might not know who Qualcomm is, Qualcomm is really the enabler of our global wireless communication system. Most handsets and smartphones and tablets, 3G, 4G, LTE, all of those things are primarily enabled by Qualcomm.
Right.
So this meeting in particular at CES this year is now demonstrating the expansion of wireless and mobile beyond those handsets to what's now, I think, being commonly recognized as the Internet of Things.
Sure, yeah.
So what does that mean? It means that not only the handsets and tablets, but your automobile, your light bulbs, your dishwasher is all now being connected. So Qualcomm Life is a dedicated business unit within Qualcomm that's focused specifically on bringing that know-how and capability to the healthcare sector, and really pursuing an agenda of enabling the Internet of medical things.
Right. Okay. Yeah.
And really that is all about kind of the obvious stuff, the blood pressure meters and the weight scales, but it's going far beyond that very quickly, which is really the connectivity of everything in healthcare. I mean, you're talking about connecting everything in the intensive care unit, the bedside monitors, the operating room, the labor and delivery, the emergency room, all the way from the hospital to the home, and every point in between. So you're really looking at the fabric of healthcare becoming connected,
Sure.
becoming interoperable, and the ability for the right information to be in the hands of caregivers, and that's not limited to doctors and nurses and pharmacists. That also means family members and friends and care.
So the notion of care coordination across the board, right? I mean, everybody gets the...
The exciting thing is that healthcare itself is in this massive transformation of going from what's called fee-for-service to value-based
Sure.
care. What is that? What's the implication of that? What that means is that we now have a healthcare system that's aligning the incentive to do everything possible to keep you as healthy as possible and out of the hospital. And how do we do that? Well, literally the only way of achieving that is by being able to take advantage of technology
Sure.
to have insight and information coming from people in their homes and into the clinical setting, so that they can see, oh, you're doing fine.
Right.
This one over here is having troubles. We need to bring that person in and take care of them.
And how do people find out about Qualcomm Life? Where can they go?
Well, Qualcomm Life is just like Mother Qualcomm is very quietly enabling all sorts of things. We're really not in the front and center. We're an enabler behind the scenes. So you'll see Walgreens with our Walgreens Connect system. You'll see right at the bottom, powered by Qualcomm Life. You'll see our Novartis.
And website for Qualcomm Life?
Website for Qualcomm Life is qualcommlife.com.
Awesome. Well, thanks so much for joining me today. This is Dr. James Mault from Qualcomm Life, and this is Laura Mitchell reporting to you live from the Digital Health Summit studio at CES 2016.